Some common types of arthritis, prevention and treatment. Hi. Arthritis is a general medical term, referring to a whole group of highly diverse joint disorders with distinct causes and characteristics. Among them, the most common types are osteoarthritis related to aging, wear and tear, causing pain and stiffness, and rheumatoid arthritis, an autoimmune disorder that attacks the joints, leading to inflammation and deformity. In addition to the two common forms mentioned above, there are many other forms of arthritis, such as psoriatic arthritis, ankylosing spondylitis, juvenile idiopathic arthritis, and gout, each of which has its own individual characteristics and causes. Now I would like to talk more specifically about some of the most typical and common types of arthritis mentioned above. 1. Osteoarthritis. This is an inflammatory condition of the joints caused by aging and wear and tear on the joints over time. This leads to the breakdown of joint cartilage, and thus causes pain and stiffness. Mobility is obviously affected and impaired. Osteoarthritis will occur mainly and most clearly in joints that have to move the most and/or bear the most weight. Therefore, pain, swelling, and joint stiffness will also appear more clearly when subjected to gravity, or with a lot of movement, or with a wide angle of rotation. 2. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder that results in the immune system mistakenly attacking the joints, primarily the synovial membrane, causing inflammation and even joint deformity. Rheumatoid arthritis is obviously chronic inflammation, causing joint damage, and is especially dangerous as the inflammation can spread beyond the joints to the whole body, attacking other tissues and organs. Some symptoms of rheumatoid arthritis are quite easy to recognize, as in the above mentioned, degenerative joint disease with typical symptoms that often occur in joints that have to move a lot or have to bear high gravity. Rheumatoid arthritis often occurs on symmetrical joints, deformed joints, stiff joints, and severe pain in the morning, fatigue, and widespread signs throughout the body. 3. Psoriatic arthritis. This is an inflammatory arthritis that occurs in people with psoriasis. People with this disease often suffer from joint pain, stiffness, and with damaged skin areas. 4. Ankylosing spondylitis. Ankylosing spondylitis is an inflammatory arthritis condition that primarily affects the spine and pelvis, causing joint inflammation and stiffness. 5. Gout. Gout is a disease of metabolic disorder caused by the accumulation of uric acid crystals deposited in the joints below the body in relation to gravity. Therefore, inflammation and swelling of the joints that occur due to gout often begin at the extremities of the limbs, and especially the lower limbs. Furthermore, because the deposits have a crystalline shape, they can cause severe and sudden sharp pain. And 6. Juvenile idiopathic arthritis. This is an inflammatory arthritis with no clear cause, often occurring in children under 16 years old. Common symptoms are painful, stiff, and swollen joints. So, how can arthritic conditions be diagnosed to ensure the most accuracy? Common medical examination and diagnosis methods today are: study medical history and physical examination using classical diagnostic methods, by observation, palpation, and common questions and answers. Imaging studies. To observe the actual condition of the joints, patients are often given X-rays, MRI, etc. Immune system studies. Patients are often given blood tests to determine signs of inflammation or autoimmune signs. So, how can arthritis be prevented and treated? Speaking of prevention, like most other common diseases, arthritis conditions can be prevented through lifestyle, specifically diet, physical exercise, and daily living.
Regarding eating, although each individual's reaction to food may be different, in general everyone needs to always pay attention to practicing informing healthy, scientific eating habits and tastes.
Types of foods and drinks that should be carefully limited are: processed foods contain refined sugar and trans fats even though they are delicious. Red meats and full-fat dairy are high in saturated fat. Fried foods contain a lot of trans fats. Alcohol and tobacco can also worsen inflammation and interfere with the effects of medication, etc. Some types that are beneficial for joint health that you should pay attention to consuming are omega-3. Omega-3 fatty acids are found in fatty fish such as salmon, flax seeds, and walnuts. Omega-3 fatty acids have anti-inflammatory properties and may help reduce arthritis symptoms. Fruits and vegetables. Fruits and vegetables in general are rich in antioxidants and anti-inflammatory compounds, and colorful fruits and vegetables may be beneficial for arthritis. Berries, cherries, spinach, and broccoli are good choices. Whole grains. Choose whole grains like brown rice, quinoa, and oats to provide fiber and may contribute to overall joint health. Nuts, almonds, chia seeds, and pumpkin seeds are examples of foods rich in nutrients that support joint health. Ginger and turmeric. These spices have anti-inflammatory properties and can help ease arthritis symptoms. Consider incorporating them into your diet through teas, smoothies, or as part of a dish. Green tea. Known for its antioxidants, green tea may have anti-inflammatory effects that may benefit arthritis. Calcium and vitamin D. Dairy products, fortified plant-based milks, and green vegetables are good sources of calcium, while vitamin D can be obtained from exposure to sunlight and supplements. These nutrients are important for bone health. Lean protein. Choose lean protein sources such as poultry, fish, tofu, and beans as they provide essential nutrients without excess saturated fat. In addition to good management of eating and drinking, sick people as well as healthy people need to diligently exercise in forms appropriate to each individual's specific conditions and circumstances, and at the same time must regularly control your weight. Do not be overweight or obese, direct or indirect risks of arthritis. For patients suffering from pain caused by arthritis, doctors may prescribe painkillers, general anti-inflammatories, as well as appropriate specific anti-arthritis medications tailored to each specific case. In addition, physical therapy exercises, yoga exercises, nutrition, massage, and acupressure exercises also work very well for many cases of arthritis and can give the patient back a sense of good health status, which is safe and sustainable, without side effects. So, to prevent and treat arthritis in general, priority must first be given to implementing preventive measures through lifestyle, through diet, exercise, and weight control. At the same time, see a doctor and have regular medical monitoring to optimize arthritis prevention and treatment options, in accordance with your specific physical conditions as well as other living conditions, preventing and treating arthritis really effectively. Wish you health. Thank you, goodbye, and see you again.